Thank you for standing by while we were fixing our technical difficulties. I'm Charity Menefee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is more of a moment of reflection for those in our community who have lost a loved one to COVID-19. Losing a family member and a friend is never easy, but in a global pandemic, we know that that can be amplified. Please know that you are in our thoughts and prayers as you navigate this unimaginable time. And before we dive into the benchmarks, I want to spend a few minutes talking about testing. While we continue to test anyone who would like to get tested at KCHD, we really want to encourage people to remember that testing is not prevention. It is just a snapshot in time. A negative test doesn't keep you from getting the virus next week, next month, or even tomorrow. If you are worried you may have COVID-19, we encourage you to please stay home. If you get tested and are symptomatic, please continue to stay home until your test results come back, which could be a week or even more, given the lab capacity lags. We know this can be difficult, but it is critical in preventing the spread. Now we'll move into the local situation. We have 1,814 confirmed cases of COVID-19 in Knox County. Additionally, we have 72 probable cases. 893 of our cases have recovered, giving us 906 active cases. 141 individuals have been hospitalized at some point in their illness, and 45 Knox County residents are currently hospitalized. We're sad to report that we had an additional death due to COVID complications today, bringing our total to 15. Once again, our thoughts and prayers are with that individual's family. Now we will continue to transition to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. Every day we look back at the previous 2 weeks, that's what a rolling average is. Overall, what we mean by this is we are trying to see, are things getting better, staying the same, or getting worse? And if so, how much better or worse, and at what rate? We will now put up the data. And as a reminder, all of this data that we are going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a graph that shows previous cases, new cases, and the growth rate over time. We have seen consecutive days of red flags and a significant continuous increase in new cases, with our largest daily increase yet reported yesterday with 118 new cases. This causes us to represent this traffic light as red. This is a concerning trend and one that we've seen over the past several weeks. It further reiterates that this virus is still very present in Knox County and the critical importance of following the 5 core actions. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test results reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs, one that shows a sample of the tests conducted for Knox County residents and another for the average time between specimen collection and lab report data. This week, this benchmark represents some challenges because there is a much greater lag time between tests that are being conducted and when they are being reported to us. As we mentioned earlier this week, we are experiencing lab delays for what could be multiple reasons. We are seeing an increase in the volume of testing and availability of testing supplies, and changes in lab processes by, for example, from AEL that we talked about previously, the lab that we are currently contracted with are among some of the potential reasons. It's important to know that this is not just a local challenge, it is a statewide and national issue. The demand is incredibly high, and labs are working around the clock to get the test processed and provide notification to public health. However, because of this backlog, we are seeing a delay in receiving results, sometimes up to 10 or more days after specimen collection. Therefore, due to this delay, we likely do not have all the tests reflected in the lag time graph or the number of tests conducted graph. Because of those reasons, we are representing this benchmark as red. As a quick note, we have used other labs in the past that are no longer able to support our testing for several reasons, some of which includes other clients or having higher demand or inability to get adequate testing supplies. We are currently reaching out to other labs in an effort to diversify our lab partners. We hope this might help cut down the lag time for our testing here at KCHD, and we will keep you apprised of any changes. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to reach out to cases within 24 hours and close contacts within 48 hours. To date, throughout this pandemic, we have accomplished that for all of our cases and contacts. Because of that, this benchmark continues to be represented as green. I want to say on that one real quick, that is from the time we received the labs, the 24 hours and the 48 hours. We continue to build out contact tracing capacity to be able to respond to the growing caseload. Additionally, as we mentioned last week, a new contract with the Tennessee Department of Health will allow us to further expand our contact tracing services. We have now received this contract, and it is scheduled to go on County Commission's agenda this month. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from information hospitals put in the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, the East Region, or patients from other jurisdictions. For this benchmark, the traffic light is yellow. We did experience days of statistically significant increases regarding positive patients, ICU patients, and ventilated patients. After speaking with our hospital partners, they stated their benchmark should be represented as yellow. The hospital systems continue to meet at least weekly, assess the situation, and plan their response together. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we show the chart that details cases, hospitalizations, and deaths. This benchmark is represented as red because we have seen a statistically significant increase in deaths. In the past 2 weeks, we have seen an increase of 9 deaths, and our case fatality rate has nearly tripled from 0.28% to 0.77% among all cases. We are working on a different way of showing the data for this benchmark, and we hope to have that available on our website soon. Before we open it up for other questions, we just want to say that we know that compared to other jurisdictions, some of our metrics may look low, which is a good thing. However, what we are concerned about is the rate at which our metrics are rising. And we're seeing that across the board. Increased cases today results in increased hospitalizations in a week or two, and that'll be followed by increased deaths. Given the rate at which things are increasing, when we think of what those numbers could be in the near future, we are very concerned. This is something that we are continuing to keep our eye on, and it's why we continue to stress the 5 core actions. So again, physical distancing, staying at least 6 feet away from each other, wearing a mask when you cannot do that, when you're out in public, washing your hands frequently, staying home when you're sick, and then frequently disinfecting surfaces. We know there can be tremendous positive impact if everyone follows this guidance. I'll now open it up for questions.
All right, the first question we have is from Brian Hornback. He says, this is from a reader. How many of our Knox County deaths were hospitalized at the time of death, and has any of them died at home?
I don't have the exact numbers. I know of at least one of them that has died at home, and several of them that were in the hospitals. We can get you that information. It's not the way we typically track it, but I do know we did have one home death.
From Scott Barker with Compass, what were the ages and genders of the 2 fatalities since Monday?
Yesterday's death was a 94-year-old male, and today's death was a 56-year-old male.
From Alex with News Talk 98.7, can you tell us any more information on the reported deaths other than age and gender, such as if any of the deaths had underlying health conditions?
That's really all we report at this time. And we just want everybody to know that there's risk across the board. Obviously, there's higher risk associated with some age groups and some comorbidities, but we are seeing a broad range of both hospitalizations and deaths.
From Megan with WBLT, can the health department provide any additional information about the previous question we asked regarding case increases and protests? Is there any explanation about why those gatherings did not appear to contribute to more positive cases while parties and other gatherings did?
You know, that's a really tough one. So what we said and what we've looked back at is when we do our interviews with our cases, we didn't have folks mention that they had been at protests or anything like that when we did those interviews and we were asking about social gatherings and group gatherings. We know that there is risk associated with large groups, especially when you can't social distance and you're not wearing masks. So I can't give a reason why we haven't seen that, but that's just the data that we have that we can provide you with at this time.
Her follow-up question is, additionally, could the use of masks at these events have contributed to stopping the virus from spreading?
Yeah, and I wasn't at the masks or at the events to know about mask use, but yes, if there was a lot of mask wearing, I would think that would have had impact on cases coming out of there.
From Amelia with WBIR, what are we seeing in the homeless population in terms of coronavirus? Initially, when the pandemic started, there were reports of lower numbers of homeless at the shelters because of fear of the virus. Are they coming back to the shelters?
I think that's a really good question for the homeless service providers. We don't have what their numbers and their volume looks like from day to day or even across periods. So suggest you direct that to them.
Her follow-up question is, has the special shelter set up for coronavirus positives been used?
It had been previously. It's not there right now. They actually have their own plans in place and would direct you to talk to the providers as well about what their internal plans are to manage positive cases within their clients.
From Vincent with the Sentinel, the Trump administration just ordered hospitals to bypass the CDC and report capacity and use data directly to them. Does this affect your relationship with regional hospitals?
No, the information that we've been getting, again, goes directly from the hospitals into the Tennessee Healthcare Resource Tracking System. That system's been in place since the early 2000s. I see nothing changing with how we receive that information that we're utilizing and looking at every day, how that gets provided to the federal government, something the state would work out in the hospitals. But ours, we don't expect any changes in what we see or how it's reported here.
Also from Vincent with the Sentinel, how many cases can your contact tracing finish approximately per day? And how many cases can the average contact tracer in your employ finish per day?
That varies greatly. So, and it's based on people answering the phones when we're reaching out to them and how many contacts they have that we then need to follow up with. But on average, the initial interview, I can say, takes about 20 to 30 minutes. That's kind of an average ballpark of time. And then depending on how many contacts need to be followed up with, that can expand that. We are changing that process a bit, and the state's going to be helping with their centralized monitoring to help with some of the contact calls. We're moving into that. But on average, if you were to talk nonstop and everybody you call answers the phone immediately, probably 10 or more a day to do all of the work that goes along with that.
Vincent's follow-up question is, do contact tracers work prior to case confirmation, or do they wait for a result to come in?
It's a little bit of both. So reported cases, we will start working as soon as we get those in, again, within the 24 hours. The probable cases, we work before getting laboratory confirmation. So again, a probable is somebody that has been in close contact with a case and is showing symptoms, and then we treat them like a case. So those are interviewed and we act on those before we have a lab report. And we sometimes don't get a lab report back because they choose not to get tested.
From Jeff with WATE, based on the changes in the benchmark status, will the health department make recommendations for changes to the Board of Health? And if so, what would those changes be?
So all that'll be discussed tonight directly with the Board of Health, and any questions can be followed up with after that.
From Alex with News Talk 98.7, why can you not tell us more information on the deaths? Is it solely KCHD policy, or is there a legal issue or something else?
That's been our policy all along with before COVID and with any other outbreak illness investigation that we're working on. And it's really to protect the privacy of those individuals and try to respect what they're going through at these challenging times. So typically we don't even report deaths or by age and sex in previous events. So I can say again, it's a broad range of age groups and categories for all of those things, and whether they have comorbidities or not, it does. Again, there's a range of what's in there. So the message to the public is everybody's at risk, and we want everybody to be taking all the preventive measures they can to protect themselves at this time.
From Scott with Compass, the hospital capacity numbers are collective, but we have heard LeConte Medical Center in Sevier County is full and patients are being transferred to other hospitals. Can you confirm this and share information about other individual hospitals?
I can only report on the regional numbers. That is a policy that has come down from the state for the data that's in Hertz. So if you have specific questions about the hospitals, I encourage you to direct it to them.
From Amelia with WBIR, is the health department still distributing free face masks? Are you close to running out, or do you need more?
We are still giving out masks, and I have not heard anything about us having issues with our volume that we've received. If that's different, we'll follow back up, but I think right now we're okay. They're shaking their head, no, we're good. We're good with our supply.
And her follow-up question is, have requests for masks from businesses gone up since the mask mandate started?
Yes, that's the short answer there.
From Scott with Compass, do you have a breakdown of positive cases that are symptomatic versus asymptomatic or pre-symptomatic?
I don't have it on me at this time in my head. It's pretty much always followed national trends and what you see in the data. So we could follow up with that if need be, but I don't have it in my head right now.
From Vincent with the Sentinel, this is the first time we have seen 4 out of 5 benchmarks hit a red or yellow rating. Do you anticipate that the board will implement a policy change in response tonight? Oh, I'm sorry. I read that before I read his addendum there. He says, ignore that. That was a question that had previously been asked. So okay. Sorry about that, everybody. Let's see. Jeff with WATE, can you elaborate on our hospital capacity, ICU, vent capacity? We're at a yellow light. Has there been any discussion of revisiting plans for alternate sites like the Expo Center?
The hospitals are talking, again, they have at least weekly meeting. I think at this point, it's many times a week that they're talking, and then we speak with them regularly as well. And they are looking at their internal surge capacity plans to be able to handle the growing number of regular non-COVID patients that need to be in the hospital and the COVID patients, and are having those discussions regularly. Again, I can't speak to their individual plans. On the alternate care site front, we do have a regular scheduled meeting to talk about that as well, and are looking into that. The big take-home message there is, if at all possible, we want to make sure we keep all the patients in the hospitals. It's the safest way to do it with the fewest resources. They can put all the resources into the hospitals, and that's our first plan of action.
From Megan with WBLT, are less positive cases requiring treatment with a ventilator than previously predicted?
I don't know that I completely understand the question. So less positive cases, we're seeing typically, or we have been seeing more ventilated patients than what we were seeing in other areas of the state with our hospitalized patients. That has gone down a little bit over the past couple of days, but I don't know what the predicted number would be off the top of my head for that.
From Amelia with WBIR, Dr. Piercy with the State Health Department said yesterday the state had gotten about 8,000 doses of remdesivir that it was distributing to hospitals in need. Do you know if Knoxville area hospitals are getting it and if it's making a difference yet?
We are not aware of exactly how that's being distributed to them. It's something we've asked about and are looking into more, and the hospitals were actually interested in finding out more about how that was going to be distributed when we spoke to them at the end of last week. So more information to come there.
From Vincent with the Sentinel, has the Knox County Health Department been tracking cases post-recovery? I ask because there are emerging reports of chronic complications from COVID-19, and I would like to know if this is something that KCHD is tracking.
No, we're not tracking that at this time. I've seen the same reports, but it's not something that we have the capacity to do in the middle of the pandemic as well.
From Jeff with WATE, can you provide us any new numbers on mask complaints, education calls, any citations so far?
I can give you some broad information. Since July 6th, we've received 122 complaints for non-food establishments and 151 for food establishments. That's since the mask mandate went into effect, and that is almost all of those are mask related. And I don't have the exact number, but education is always the first step to follow up with those facilities.
Any other questions? Please go ahead and submit those now. All right, not seeing any other questions come in. Thank you all for joining us. We'll have the media briefing again on Friday at the same time. Have a